Glaucoma presents a video series with editorially independent content supported with advertising. Do you ever wonder or get confused trying to figure out what medications to use after MIGS surgery? Well, in this video, I'm going to shed some light on how to make those decisions. Hello, and welcome to the Glaucoma YouTube channel. My name is Dr. Constance Okeke, glaucoma specialist and cataract surgeon and creator of this MIGS Meds University video series. There are three areas I focus on when making postoperative medication decisions after MIGS surgery, and they surround prostaglandin analogs, target pressure, and potential complications. So let's break down each. Prostaglandin analogs, or PGAs, are commonly used first line. It is well known that PGAs are to be used with caution in patients who have active inflammation or macular edema. So I simply stop PGAs in all patients post-MIGS or post-MIGS with cataract surgery. Generally speaking, if the patient still needs some pressure control during the early postoperative period, I would then choose a single or fixed combination drop to add rather than restarting the PGA. However, after adequate healing from the MIGS procedure, when there's no inflammation in the eye and no apparent risk, I may then consider restarting a prostaglandin analog for simplicity and efficacy. Now, when it comes to whether or not to stop other medications if they were on non-PGAs prior to surgery, for that I will look at what the target pressure is set at. Now, if you want my method of setting target pressures, check out the link below or the card above. Now, if postoperative pressures is way below the target, I will still likely keep the patient on the same medication, but may look to simplify the dosing regimen. Keep in mind there are several factors that can affect the patient's pressure through the early postoperative period that I will mention in more detail below. If you try to take away too many medications in the beginning and then have to add them back later, this is harder on the patient in terms of their level of expectation and feeling that the surgery is going well. While observing pressure, one needs to also be aware of potential complications such as bleeding, prolonged inflammation, synechial formation or PAS, and steroid response. These issues will warrant changes in medications that are dependent on the level of the problem. For bleeding, I typically will increase steroid usage either in frequency or potency. For inflammation, will increase steroid usage either in frequency or potency, and or may increase usage of NSAIDs. For PAS formation, I typically will add use of pilocarpine to try to help prevent further scarring. And for steroid response, I will add additional medications while trying to decrease the frequency or potency of the steroid. All the while, adding additional medications as needed and as tolerated to maintain at or close to target pressure. Those are some tips that I use when I'm trying to decide what medications to use after MIGS surgery. If you want some actual case scenarios, take a look at the guide that I've attached in the description box below for some more specific vignettes to help further. If you like the video, give me a thumbs up and share this video with a friend or colleague who may benefit also from the video. Thanks for watching the Glaucoma YouTube channel, a place where glaucoma innovation is made easy for eye care professionals.